Postbabesiosis were autoimmune hemolytic anemia. Definition background. Babesiosis, a tick-borne zoonotic disease caused by intraerythrocytic protozoa of the genus Babesia, is characterized by non-immune hemolytic anemia that resolves with antimicrobial treatment and clearance of parasitemia. Usually affects domestic animals, especially dogs. Named after Romanian biologist Victor Babes, who was the first to isolate the pathogen, was established in his honor.
Babesia is a protozoan parasite of the blood that causes a hemolytic disease known as babesiosis. Babesia is spread through the saliva of a tick when it bites, but also, rarely, through blood transfusions. Deer ticks are pathogen-free when they hatch from eggs and are known as larvae at this stage in the deer tick life cycle. These newly hatched larvae wait for hosts in the leaf litter on the ground. This is where the Babesia parasite lives, in the blood of white-footed mice also inhabiting and passing through the same larvae-infested leaf litter. Larvae become infected with Babesia when they take a blood meal from white-footed mice. After transforming from the larval stage into nymphs, these newly infected nymphs are ready to transmit Babesia to human hosts during the nymphal blood meal. As you can see here, the deer tick goes through several stages. They start by attaching to the mouse as larvae, then becoming gorge larvae, which finally become nymphs. Once the poppy seed-side nymphs latch onto a host, they usually crawl upwards until they reach a point where clothing restricts any further upward movement. The tick then uses its cutting chelicerae to make a hole in the skin and quickly sink their barbed hypostome into the hole. Within a short period of time, the tick begins a complex cycle of salivation and sucking. Their saliva contains hundreds of pharmacologically active molecules that suppress the host's ability to fend off the invader. The tick slices through small capillaries, creating a pool of blood that remains uncoagulated due to the tick's salivary anticoagulant. Over the next several days, the nymph feeds unnoticed because of its small size and the pain-killing chemicals it secretes. It also will begin ingesting blood, increasing in size tenfold. By day 2 of attachment, Babesia sporozoites will have matured in the tick's salivary glands and are transmitted to the host as the tick salivates. Parasites mature in the mammalian host, invading the host's red blood cells, which are critical for carrying oxygen throughout the body. As the parasites develop, they kill the red cell, releasing toxic heme and other fever-inducing chemicals into the bloodstream. In severe cases, 3 to 6% of the red blood cells may be parasitized. Humans infected with Babesia may experience spiking fever and chills, and as more red blood cells are destroyed, may become anemic, exhausted, and in some cases even die from respiratory distress.
Applications in medicine. In the veterinary treatment of babesiosis, usually not antibiotics are used. There is a vaccine that is effective against Babesia canis canis, but is not effective against Babesia canis rossi. It means Babesia causes a mild form of the disease that often resolves without treatment.
Hi, this is Dr. Karen Becker. Babesiosis is a disease caused by the intracellular parasite Babesia. Dogs are most often exposed to the parasite through the bite of an infected tick, but transmission can also occur via blood transfer from a dog bite, from a blood transfusion, or from across the placenta from an infected mama to her litter of babies. When babesiosis is a tick-borne infection, it's not unusual for an affected dog to have additional tick-borne infections, including ehrlichiosis, Rocky Mountain spotted fever, and others. These infections can interact, making each one more severe. Dogs that spend a lot of times outdoors, especially in the wooded areas, are certainly at increased risk for tick bites and for contracting the parasite, especially during the summer months when tick populations are highest. Young dogs tend to suffer more serious symptoms, and greyhounds, pit bull terriers, and American Staffordshire terriers appear to be more susceptible than other breeds. Most canine cases of babesiosis occur in the southern part of the United States, with pockets of disease also reported in Massachusetts, Pennsylvania, and New Jersey. The incubation period between exposure to the parasite and symptoms is about 2 weeks. A Babesia infection can have very mild to no symptoms, or it can be very, very severe. Babesia parasites replicate in the red blood cells, and as the red blood cells are destroyed, hemoglobin is released into the dog's body, which can lead to jaundice as well as anemia, including immune-mediated hemolytic anemia. In addition to destruction of the red blood cells and the anemia, the severe inflammation that can occur with babesiosis can be overwhelming and completely separate from the anemia. Blood clotting can be impaired, and a variety of neurologic symptoms can also occur when the parasite invades the central nervous system. In severe cases, there can be lung damage and liver disease as well. Severity of the symptoms depend on the species of parasite involved and on the ability of the dog's immune system to defend against it. Babesia strains reported in the U.S. appear to cause milder forms of disease than when the disease is found elsewhere in the world and in other species. Symptoms may come and go as the disease runs its course and can include lack of energy, lack of appetite, weakness, fever, pale gums and tongue, orange or red colored urine, discolored stool, weight loss, enlarged lymph nodes, an enlarged spleen, and jaundice, which is yellowing of the eyes and skin. A severe infection can affect multiple organ systems, including the lungs, GI tract, kidneys, and the nervous system. Diagnosis of canine babesiosis can be actually really challenging. Your veterinarian will take a complete history to identify any possible incidents that might have exposed your dog to a parasitic infection. And in addition to a physical examination, he or she will also do a blood chemical profile, a complete blood count, and a urinalysis. Your vet might also use a Wright's stain to check a blood sample for microscopic examination. Immunofluorescent antibody, which is called IFA testing, may also be performed, but it's often difficult to differentiate between species and subspecies of the parasite with an IFA test. In addition, some infected dogs, especially young dogs, may have no detectable antibodies. PCR, which stands for polymerase chain reaction testing for the presence of Babesia DNA in a biologic sample, can differentiate between subspecies and species and is actually more sensitive than other type of testing methods. While only certain laboratories run the PCA test, it's really the very best method for confirming a Babesia infection. A severely ill dog, especially one that requires fluid therapy or blood transfusion, should obviously be hospitalized. Unfortunately, the drugs used to treat babesiosis are not always effective and actually can have really serious side effects. So in asymptomatic dogs, drug treatment is not worth the risk. In addition, oftentimes drug therapy relieves the symptoms of the disease but doesn't actually clear the parasite from the dog's system. The dog can remain infected, and the infection can flare up during times of stress or immunologic imbalance. I put chronically ill or infected dogs on several nutraceuticals and herbs, including beta-glucans that requires fluid therapy or blood transfusion.
Pros and cons of the treatment for babesiosis. Pros: efficacy of azithromycin and compounded atovaquone. Another pharmacologic therapy is the use of the combination of clindamycin and oral quinine. Cons: medication resistance, inadequate plasma and tissue levels of medication due to poor absorption or rapid elimination. Retreatment occasionally fails, and patients report frequently side effects, including tinnitus, impaired hearing, and diarrhea.
Now, Babesia is probably the most common co-infection that I'm finding in my patients. And it's the one that is keeping many of the European patients who come to see me and many of the American patients sick. Now, when would you suspect a patient has babesiosis? Well, if they come in with the classical symptoms of Lyme, they have good and bad days. The symptoms come and go. The joint and muscle pain and nerve pain migrates around the body. It gets better and worse with antibiotics. It's changed by hormones. But they say to you, I have day sweats. I have night sweats. I have chills. I have an air hunger, a dyspnea, where I can't explain why I can't catch my breath. I have a cough that I can't explain. They don't have allergic rhinitis. They don't have asthma or COPD. They don't have GERD and reflux, which accounts for 99% of our coughs. That is a classical presentation for babesiosis, especially in a patient that is 3 times sicker and has not gotten better with Lyme treatment. What Babesia does is it makes all of the Lyme symptoms worse. Whether it's your fatigue, your joint pain, your muscle pain, your nerve pain, your memory and concentration problems. We have had resistant patients being treated for Lyme that once they were treated for Babesia, they got better. There was one patient in France who just came to me. She was sick for 13 years, being unable to be helped by French physicians. We discovered Babesia while 1 done cani. I gave her Mepron, atovaquone, with azithromycin, with Septra, Bactrim double strength. And within 1 month, she said to me, I feel incredibly better. I can now get out of bed. My muscle and joints don't hurt. I have better energy than I've had in the last 13 years. And it was not picked up because they were not testing in France and in many parts of Europe for these different strains of Babesia. So you can get Babesia WA1, Babesia duncani, and Babesia divergens, all of these different Babesia species, but the problem like Lyme, where there's 100 different strains of Lyme in the United States and 300 worldwide, there are over 100 different types of Babesia called pyroplasmosis. And we're not going to pick up all of these different strains of Babesia. So what you need to do is a Babesia panel. The Guillemets stain that most doctors were taught to treat and to test for Babesia will only pick up Babesia if the level of parasitemia is greater than 5% in the blood. You will not pick it up otherwise on a Guillemets stain. We have to use a panel approach of an immunofluorescent assay, a fluorescent in situ hybridization, a FISH test, the RNA probe that Dr. Shaw talked to you about, and a PCR test. And we will find that an IFA can be negative, but a PCR can be positive. Or an IFA and a PCR can be negative, but a FISH can be positive. So if you have a patient with these malaria-type symptoms and they're not getting better, and you've ruled out by differential diagnosis the other cause of drenching sweats, they don't have hyperthyroidism, they don't have tuberculosis, non-Hodgkin's lymphoma, hormonal failure. To discuss differential diagnosis more in detail tomorrow. You must suspect Babesia in these patients, and you should give them a trial of anti-malarial medication. It makes a huge difference in getting many of these patients better.
Issue applied in Ecuador. There has only been one case in our country. A 72-year-old male presented with increased left lower quadrant abdominal pain and distension for 1 year. He experienced nausea, vomiting, diarrhea, fever, chill, and myalgias. He reported 9 kg weight loss over the last 2 months.
Hello, I am Adebayo Olufunke from Nigeria, and my work is on clinical monitoring and diagnosis of babesiosis in dogs in Nigeria. Babesiosis is an emerging tick-borne disease which causes anemia, icterus, hemoglobinuria, and death in affected dogs. It presents varying clinical, hematological, and pathological manifestations in its host, depending on the species and subspecies involved. Clinical, laboratory, and molecular detection of Babesia species are carried out in different parts of the world where the disease is endemic. In Nigeria, records show an estimated 30% annual morbidity, while diagnosis is still largely based on clinical and laboratory findings. Thus, this study monitored clinical indices associated with canine babesiosis to determine how efficient they are in the diagnosis of the disease. With informed client consent, 103 dogs suspected to have canine babesiosis were included in the study, which showed a result of 61.1% positive cases based on thin blood smear. Furthermore, this study showed the incidence of canine babesiosis among breeds, sexes, and age groups. It also compared vital parameters and hematology between the positive and negative groups. This study proposed reliable markers which could be used for diagnosis of canine babesiosis, especially in developing countries where molecular identification is unaffordable.
Conclusion. It was documented post-biosis WAHA in patients who did not have a history of autoimmunity, as splenic patients appear to be particularly at risk.
At the end of her tether, Brittany makes one last appointment with Dr. Daniel Jala. Her symptoms were compatible with a diagnosis of chronic Lyme disease, but I began to suspect there might be something else going on in addition to Lyme disease. Dr. Jala orders a series of blood tests to confirm his hunch. 1 month later, Brittany and Patty receive the results. Brittany's test results showed that not only did she have persistent Lyme disease, but also confirmed that she was suffering also from babesiosis.
I had never heard of babesiosis before in my life. I was completely shocked.
Babesiosis is caused by a protozoan parasite called Babesia microti. When a person's infected, the parasite targets red blood cells, which transport oxygen throughout the body, and that can cause numerous problems for the host.
Inside Brittany's bloodstream, the Babesia parasites continue to invade red blood cells, where they feed and reproduce. Eventually, the parasites destroy the red blood cells, flooding the body with their offspring. As the Babesia parasites wipe out the cells, Brittany's oxygen levels decrease, resulting in extreme fatigue.
It was very frightening and scary to know that I've had a parasite living in my body for the past 8 years and I didn't even know it.
In many cases, those infected don't experience any symptoms because their spleen is able to remove the infected cells from the blood. But when the body's immune system is compromised by another condition such as Lyme disease, the spleen can become overworked and the Babesia parasite takes hold. If that happens, the consequences can be dire.